Hi, I'm going to speak to you today about preparing for bariatric surgery at Community Medical Center. Please remember to have your favorite protein shakes, sugar-free ice pops, and low-sodium broths already purchased prior to surgery. Please remember no straws, no carbonated beverages, no caffeinated products, and especially no smoking. This includes vaping. You will be tested for nicotine prior to surgery, and positive results can cancel your surgery. Please remember to switch out any non-steroidal anti-inflammatory type medications such as ibuprofen, naproxen, and Motrin. These medicines contain aspirin and they can lead to ulcerations and bleeding in your new stomach. We do recommend the use of Tylenol products after surgery, and they can be taken in any form, liquid or pill. If you do need something stronger for pain after surgery, please contact your surgeon's office. Now is also a good time to think about your post-surgery medications. Take a look at the pills that you take. Are they really big? If they are too big to be swallowed whole, can they be cut? Can they be crushed? You may have to talk to your local pharmacist if you're not sure. We do recommend that you take one pill at a time, which is one pill every 15 minutes with a small sip of water. And if you have any questions in regard to this, please ask our surgeon. What to bring and what not to bring to the hospital. We do recommend bringing comfortable clothing and a favorite pillow for hugging as you get out of bed. Please bring your insurance and ID if you were prescribed a CPAP and your phone and charger. Leave your jewelry and valuables at home. To prevent potential complications, we will give patients blood thinners at the time of surgery, provide you with compression stockings to wear on your lower legs, and encouraging early ambulation. We do provide antibiotics, which are given at the time of surgery to prevent infection, but also you can help yourself by frequent hand washing and not picking at the incisions on your belly. To prevent any respiratory complications such as pneumonia, we recommend coughing and deep breathing frequently using the intensive spirometer that is provided to you and walking around after surgery. Please note, if you are on blood thinners or antiplatelets such as aspirin, Coumadin, check with your prescribing physician and surgeon as to when you should stop taking these medications before surgery. Also, let your surgeon know if you are on birth control. And pre-admission testing is very important. Please do not miss this appointment. Rescheduling can result in delaying your surgery. Preparing for an early recovery. We've implemented some new protocols to help you recover faster and get home as quickly as possible. So the next few slides will discuss that. Preparing for an early recovery. During your pre-admission testing appointment, you'll be giving antiseptic wipes and instructions that you will follow to use these wipes the evening before surgery and the morning of surgery. This helps prevent surgical site infections. The nurse will review your medications and go over what you should be taking and not taking the morning of surgery. Remember, the evening before surgery, we recommend 2 extra-strength Tylenol and then the other medications that were prescribed by your physician. In addition, for an early recovery, we're also going to be providing Ensure pre-surgery drinks. This provides complex carbohydrates and provides energy, promotes hydration, and can help you feel better after surgery. 2 differences. If you're diabetic, you will get a bottle to drink the night before. We recommend drinking the entire bottle in less than 15 minutes. If you're not a diabetic, then you will drink that same bottle in the morning of surgery as soon as you wake up, or at least 1 hour before you leave your home to come to the hospital. Again, try to drink the entire bottle in 15 minutes or less. The big day, what can you expect? It's typically a one-night stay in the hospital. We will like you to arrive 2 hours prior to your surgery time. You'll enter the hospital through the outpatient entrance and go to same-day surgery to be checked in and registered. On the morning of surgery, again, non-diabetics will drink the Ensure pre-surgery drink when you wake up. Drink that entire bottle in 15 minutes or less. Complete your antiseptic wipes. Wash your abdomen before leaving for the hospital. To ensure safety, you will be asked to state your name and date of birth several times during your stay, so please remember to bring your driver's license or a form of identification. Your surgeon and anesthesiologist will visit you prior to surgery to discuss the procedure and answer any questions. On the day of surgery, after you're finished, you will go to the post-anesthesia care unit. That's where you recover from your sedation. The nurse may offer you a sugar-free lozenge to help wake up your gut. And then once you are fully awake from your anesthesia, you will be transferred to 3B. That is our designated bariatric unit at Community Medical Center. Your family may visit once you are in your room. And as we discussed earlier, please remember to cough and deep breathe and to walk. When you're ready to get up the first time, please notify your nurse due to the risk of falling from having anesthesia. Continued on the day of surgery, we hope that your pain is minimal, but we will monitor you, and if you need anything for pain or nausea, it will be provided. During the surgery, the surgeon does use a local anesthetic to create a numbing effect on your abdomen, which does help aid in reducing postoperative pain. We do provide non-narcotic forms of pain management. If you need something stronger, please just ask the nursing staff. We hope by using less narcotics, your body can return to normal function quicker and you should feel better sooner. If your pain is unbearable, though, please let your nurse know so that you can be medicated promptly. Some of the equipment you can expect to see is a heart monitor, the incentive spirometer, those compression stockings or boots, those medicine cups, that's where you'll be drinking your fluids from, a bed alarm, and fluids that are intravenous. On the day of surgery, when beginning your liquids, please remember to start slowly, take small sips, try to get 1 to 2 ounces in per hour using those small medicine cups. Gradually increase your fluids to 3 to 4 ounces per hour, and by the time you leave the hospital, you should be tolerating at least 4 ounces per hour, which means 1 ounce every 15 minutes. Continue to drink 4 ounces or more from the time you wake up until the time you go to bed. Surgery aftercare, we provide this worksheet to monitor your progress and provide reminders of what is expected during your hospital stay. Surgery aftercare, your goals should be continued frequent walking, deep breathing exercising using the incentive spirometer, and tolerating your liquids. Remember to try to use that incentive spirometer at least 10 times an hour. Remember to sip your fluids 1 ounce every 15 minutes while awake, and just get up and move. Walking also helps with gas pains too. The afternoon of post-operative day 1 is typically the day that you go home, so your goals at home should be to continue frequent walks and deep breathing exercising using the incentive spirometer. Remember your protein drinks, they're very important for healing. Please don't lift anything over 10 pounds until you're cleared by your surgeon, as well as abdominal exercises. You can drive when you're no longer taking narcotic pain medication for 24 to 48 hours and can move freely in the car. In addition, you must have somebody available to drive you home after your hospital stay. If you have any issues at home, we do recommend calling your surgeon. Typical issues might be a high fever, redness, warmth, foul-smelling drainage from one of the incision sites, difficulty breathing, or a worsening pain or change in your pain. If you're dizzy and confused, please call 911. If you have no bowel movement from 5 to 6 days after surgery, please call your surgeon or call our office. And remember, if you're constantly vomiting and can't keep any fluids down, please call the surgeon. The numbers are listed below, so if you have questions for Drs. Binnenbaum, Barreo, or Matheru, you'll contact them at that number. For Dr. Jovansik, you'll contact him at that number, and Dr. Olinikoff. Do not call our bariatric center because we do not have an answering service on the weekends and holidays. So, in summary, don't forget the evening before surgery to take 2 extra-strength Tylenol, shower, dry, and then use the chlorhexidine wipes on dry skin, and drink your Ensure pre-surgery drink per instructions. Remember to drink and walk and follow up with your cardiologist, medical doctor, or endocrinologist soon after surgery. Take your incentive spirometer home with you and try to use that for at least a week after surgery. These are some instructions in regard to the washcloths that we're providing. Please remember, do not flush these wipes down the toilet. Throw them away in the trash. These are instructions on how to use the incentive spirometer. Basically, you're going to inhale slowly, hold that breath for 3 seconds, and then breathe out into the device. You want to repeat that 10 times an hour. Your goal is to try to reach between 1,500 and 2,000 mLs. Thank you for your time and attention.